Good morning. It's a beautiful day in Michigan, and before I head to the hospital for surgery, it is time to walk my puppies. I have 3 senior rescue dogs. The first one here is Bella. She's 12. Here's Nums. He's 14. And we've got little Max, who is 12 as well. I live in Birmingham, Michigan, which is one of the suburbs of Detroit, so you may see me walking my dogs outside near the downtown area. And then it's time for breakfast. This is my favorite breakfast, which is a smoothie with all the good stuff in it, including greens and fruit and protein and healthy fat as well. Yummy! I do all of my surgeries in a local hospital, and here I am walking through the parking lot. Time to go on in. It's going to be a great day in the operating room. I do all my surgeries at outpatient surgical centers attached to local hospitals because it's safe and you have great privacy. Unfortunately, one of my local hospitals does not trust their doctors and nurses that they're not going to steal their scrubs, so we have to input our ID and get our scrubs one at a time through the fancy little scrub machine here. Time to get going. My first surgery is a young woman who's lost over 100 pounds, and as you can see, she's got some excess skin to remove. So this is the skin that we're going to tackle, and I'll go ahead and mark her and show you what I'm planning to take off. So you can see here, that is all the skin that I'm planning to remove. We're also going to do some lipo of her hips. All geared up and ready to go. Here are her markings. We're going to plan to make an incision, basically going from hip to hip and removing all of this. Just another look at it, and it's going to be hopefully a very impressive result for her. Time to scrub up and head into the operating room. And these are just a few of the instruments that we'll be using for the surgery today. A few hours later, her surgery is done. I took over 6 pounds off of her. All right, next case is a facelift. Let's take a look at the patient. Our patient is a 63-year-old woman who does not like the looseness of her neck and her jowls. So we're going to be performing a lower facelift for her to tighten up the lower neck, to smooth that jowls, and to get rid of all of that excess skin. I'm also going to be performing some dermabrasion of her upper lip, and this is a way to help smooth some of these lines in the upper lip. And finally, I'll also be doing an upper blepharoplasty, which is removal of excess skin of the eyelids. All right, we're here in the operating room, and let me show you, these are the incisions. We're going to make incisions in front of the ear, and then extending behind and down just in front of her hairline in the back. And this is her jowl, and the idea is to pull her in this direction to get a nice lift. And I'll show you how she looks when we're all finished. All right, we're all done. She looks a little scary here, but you can see her neckline is much, much better. She does have little scars around her ears, and those should heal real nicely. Also did some dermabrasion of her upper lip to help with the wrinkles up there and remove the extra skin of her upper eyelids. Our final patient today is a 31-year-old woman who underwent previous breast augmentation by another doctor, and as you can see, it left her very asymmetric. This breast is sitting much lower than this one because this implant is sitting lower than that one. When she went back to him for a revision surgery, he reoperated on her, leaving her basically the same. And so today what I'm going to do in surgery is I'm just going to operate on this side, on her right side. We're going to remove the implant. I'm going to release muscle that I think is holding it up and remove scar tissue. Okay, so we are in the operating room now, and you can see as she lies down, you can see the big difference between her two breasts. This one being the one that has settled, this one having the likely capsular contracture and the muscle that hasn't been divided. So I'm going to go through her old scar on this side. We're going to dissect up to the breast implant, see what the heck's going on. We're going to change her to that dual plane pocket and hopefully get her more settled. And we're going to put a brand new implant into her as well. All right, we are all done. Her surgery went really, really well. I'm real happy with what we were able to do. Basically, when you take a look, her implant used to sit way up here. We brought it down. She had a lot of muscle here that was unreleased, and so I went ahead and released that. I removed a good amount of scar tissue, although the scar tissue wasn't too thick. Now, because this side has had more time to settle, long time compared to this, it's going to take some time for this one to catch up to it. But this is definitely the start that we're looking for, and I think a couple months from now, she's going to be hopefully really, really happy with her result. Well, it was a long but great day in the operating room today, so now it's time to put my scrubs back and head back to the office. But first, it's time to get an almond milk hot chocolate at Starbucks. Yum. I drive a blue Cadillac SUV because I live in the Motor City. I gotta drive American cars. My office is on the 12th floor of a high-rise in Troy, Michigan. This is actually the tallest building in the town. Time to head on in. Before my patients come in, let me show you where we see them. I've got 2 post-operative exam rooms, one right over here and one over here. And they each have the trusty air doctor. And I'll show you what the coolest thing about these rooms is there's a sliding door here where we can take photographs. I've got 2 post-operative patients to show you today. Let's start with the first one. This is a 40-year-old man who came to see me because he didn't like the puffiness of his lower eyelids. He also didn't like the excess skin of the upper eyelids as well. So I performed an upper blepharoplasty on him 3 weeks ago, where I removed the extra skin of his upper eyes and I removed the puffy fat. The great thing about the lower blepharoplasty is that I can take that fat out, remove it, and do it without any visible scars. It's a real cool way to do it, one of my favorite operations. All right, this is 3 weeks out, and you can see the puffiness under his eyes is gone. The upper eyes have been opened up, but they look real natural, which is totally key for a guy. You don't want it to be overdone. Our next patient is really interesting. She's a 37-year-old woman who underwent breast augmentation with saline implants and a breast lift way back in 2008. Over the last several years, she's been having symptoms that we call breast implant illness. And these symptoms include hypertension, weight gain, brain fog, hair loss, and other symptoms as well. And she's concerned that her implants were making her sick. So here are her photos, and as you can see, she has what we call a waterfall deformity. And that is how it looks like when the implant is sitting a bit higher and the breast tissue has fallen below it. So 9 weeks ago, I performed a lift to relift everything, removed her implants, and removed the scar tissue around it. Now let's take a peek at how she looks like today. You can see everything has settled real nicely. Even without the implant, she has a really nice shape to her breasts, so we're both real happy with how things are healing. And even more important, her symptoms of BII are getting better. Well, that's the day in the life of a plastic surgeon. Please subscribe to my channel because a lot of great things to come. And remember, eat real food, use clean skincare, and always consider actual plastic surgery as a last resort.